This dog presented with a history of pancreatitis, which is just inflammation of the pancreas, and he's had kind of an acute deterioration. We had treated him a couple of weeks ago. He's making steadily improvements, and then acutely went downhill after that. Has a high fever, some increased respiratory rate and effort. We're worried because he's had an acute onset of vomiting. We're a little bit worried about secondary pneumonia on top of the pancreatitis, which seems to be flaring up. Try and get to the bottom of it and make sure that we get him better hydrated, relieve any discomfort that he may be having, and seeing if there's anything else specific that we can do to treat the problem.
Our students, they're in veterinary school for 4 years, and during that 4-year period they spend 2.5 years in the classroom getting the didactic book knowledge stuff. And then the last 1.5 years is spent the clinical portion.
I was in a boarding kennel when this happened.
Every 3 weeks the students are required to switch rotations. And a rotation is a clinical experience, basically. So they might spend 3 weeks on ophthalmology, then another 3 weeks on anesthesia, then 3 weeks on cardiology, then 3 weeks in emergency critical care.
The nice thing about emergency is it involves all aspects of veterinary medicine. So you really get to learn a lot, and it's really hands-on. It's a really good rotation with broad spectrum of knowledge that you have to put into it.
I think the students sometimes come in nervous to the emergency and critical care rotation. We tend to be a pretty time-intensive service, but our goal for that time is to give them very much a real-world experience, get them dirty, get their hands on the patients, and doing a lot of procedures.
It is definitely more stressful dealing with those patients that you have to figure out what's going on within a matter of seconds and react within a matter of seconds, but there's so many people around to help and things like that there's no need to feel too pressured.
We tend to be a pretty busy service, so they see a lot of patients, and that I think that helps them build experience, obviously, confidence, and the ability to work efficiently, which veterinarians out in the real world have to do. People have started to recognize the need for students to be educated in both emergency and critical care medicine, and so it's been a growing specialty. Right now, there's been so much interest in it at Michigan State at our student level that we have more students that have left Michigan State and are currently in resident training programs in emergency and critical care than any other school in the country.